Okay, good afternoon. Today, due to the increase in the rise in cases and for the safety of the news individuals here, we're going to be keeping on our masks, so I want to ensure, number one, can you hear us? Sounds good? Okay, thank you. So first, as I started, I believe, every single press conference after about the first or second one, I just want to say a sincere thank you to Dr. Martell, the entire team here at Winnebago County Health Department, and also the entire team at the Emergency Operations Center. Our Emergency Operations Center has been up, I believe, since March 12th or March 13th, and have just been doing a great job. So, as we see, the healthcare crisis is growing in our community, in our state, and across the country, and we're also seeing challenges to our business sector continue to increase. We will continue to advocate for support and relief for all members of our business community. Earlier this week, we were able to announce a hospitality grant program, and I just want to cover this program briefly with everyone. This initiative is a $900,000 grant program that's targeted towards Rockford's restaurants and bars that continue to face significant challenges due to COVID-19 crisis. We opened the applications for this grant program this week. The grant program will reallocate CARES Act funding to supplement state and federal relief programs with grants up to $7,500 to our independent bars and restaurants. This will help those that have been adversely impacted by COVID-19 and the state's mitigation measures. Restaurants and bars will receive an application to which they can go on the City of Rockford website for grant funding, and we hope to have these dollars into their hands by mid-December. This is a new grant program and is just one of the ways that the City of Rockford is working to help lessen the pain, but we also are very cognizant. We know that these dollars are simply not enough, so we're going to continue to advocate for our business community at the state and federal levels. Shortly, you are going to hear from Dr. Martell. And if you're listening today, or if you've been following our press briefings and the wonderful media coverage surrounding COVID-19, you know that we made progress back in the late spring and early summer. We made that progress because we were working together. Now the data is showing us that we are moving in the wrong direction, and we are moving in the wrong direction very quickly. Our local hospitals are coming under immense pressure. They are ordering extra beds to accommodate more patients due to the increase in cases. The statewide Emergency Operations Center is now at its highest level. Fortunately, we do have strong supplies of PPE for our healthcare workers, but they are going through this PPE rapidly due to the increase in cases in our community. I talk frequently about working together on a host of different initiatives. Perhaps at no other time has it been more important than it is right now for all of us to work collaboratively and work together to slow the spread of this global pandemic. So today, I'm calling on all of the mayors, all of the village presidents of our communities in Winnebago County to enforce the increased mitigation rules. In the City of Rockford, our code enforcement team will be enforcing these rules, including no indoor dining or social gatherings, requiring employees and customers to follow mask and social distancing requirements at all businesses, and adhering to occupancy limits with retail stores and other businesses. Our efforts are far more effective, and this is to the mayors, our efforts are far more effective when we work together and in unison. The new mitigations are difficult for everyone. However, we all need to work together so that we can ensure we get through this together. This is not just about restaurants and bars and the hospitality businesses or other places that we have an opportunity to gather. This is about our retailers that need to watch their occupancy. This is about our gyms and fitness centers. This is about our houses of worship that need to keep their members and their congregants healthy. We're doing this at the City of Rockford. Our employees are now working remotely when and where they can, and beginning tomorrow, and like we did in the spring, we are closing City Hall to visitors to minimize crowds and protect our employees and the public. I hope people I just want to spend 1 second. So we are going into the Thanksgiving Day holiday. So I am incredibly fortunate. I come from an amazing family. I like to think that they're amazing. I'm youngest of 6. When we get together for a regular breakfast, we have 30 people at that regular breakfast. When we get together for Thanksgiving, we will routinely each year have 50 or 60 people gathering. This year, for my family, is probably like many others who have dealt with difficult years, is a little bit more difficult. We lost my father this year, and we want nothing more than to be together. But this year, we are not doing that. This year, we are having Thanksgiving in our own households, and we will visit with each other virtually. You're right, it's not going to be the same, and in many aspects, it will be awful. But I want to share something I saw today that I think is incredibly apt, and maybe some will think it goes overboard, but in some regards, I hope it does. A virtual Thanksgiving sure as heck beats a Christmas in the ICU. So please consider going virtual, as difficult as it is for this wonderful Thanksgiving holiday. No one is enjoying what we're going through right now. We all want to get to the day of post-COVID. So let's ask ourselves, what can I do to keep my family, to keep my friends, to keep our healthcare workers, to keep our first responders, our co-workers, myself, and my entire community safe and healthy? And there are those same things that we know we all can do, and that we can take personal responsibility and we can take personal action to help slow the spread of this deadly virus in our community. Wear a face covering, practice social distancing, avoid gatherings as difficult as it may be, especially during the holidays. Work remotely, and employers, encourage your employees to work remotely if they are able, and wash your hands frequently. So with that, I will introduce Dr. Martell.
Good afternoon. And again, I want to thank the mayor for his leadership. It's hard to believe that we are 8-9 months into this pandemic, and we've been doing these briefings to keep the public informed. The leadership of our largest municipality is extremely important. And I asked the mayor to go first today to give some context, because all 3 health system partners, Mercy Health, OSF Healthcare St. Anthony Medical Center, and Swedish American Health System, have been working together as one system to care for individuals with COVID-19 since November 6th of 2020. And I know that seems like when we bring them up and we bring up hospitals, we forget that normally these are competitors. And now they're having to work as one hospital system to care for our community. The system, the one system, has surged to create additional capacity to care for both COVID-19 and non-COVID-19 individuals, and are using the beds that were requested through the Illinois Emergency Management Agency to expand that capacity. The one system, though, wanted me to share with you the following numbers for COVID-19. At present, there are a total of 193 patients hospitalized for COVID-19 in our one system. 41 are in the intensive care unit. That represents 21%. And 27 are on ventilators, or 14%. And while we function as one system, we are also a regional partner to others in Region 1. And overall, there are 282 patients hospitalized with COVID-19. So you can see that our one system cares for the vast majority. 62 patients are in the ICU, so 21% overall, similar to our system. and 35 patients are on ventilators, or 12%. Our one system is caring for the most critically ill in the region. This one system is also working to develop a community standard and guide for the administration of monoclonal antibody therapy. And I'm going to give this one is hard to say, with a mask or without a mask. Bamlanivimab. It's another therapeutic, and it can help individuals, and initial data indicates that for every 10 patients treated, it will prevent one hospitalization. Not all hospitalizations, one hospitalization. So that one system is looking at how do we provide that therapy, which requires a 1 hour infusion, 1 hour of monitoring, and you know the setup and admission that would be required. So the key here is not to need that. That's what we must all work to do. So those numbers are sobering. I'm going to give you some other more sobering numbers. The Winnebago County Coroner has had to activate his plan to support this one system and has requested additional asset to store the remains of deceased until advanced directives can be implemented. And so while we gather remotely over the holidays, even before, it's important for families to have this difficult discussion regarding advanced directives. And that includes discussions regarding mechanical ventilation. I've told you that 14% that have been hospitalized have required ventilation. Life support, disposition, what funeral home, what services do you want? These become important because if they have to implement that advanced directive, it has to be timely, because these hospitals are surging at very rapid pace. So this isn't meant to scare you. It's meant to have you take some action. So make a plan. Make a plan for your loved ones and with your loved ones, for your pets, and more importantly for you, so your wishes can be respected. So as we report at the hospital numbers, we kind of come back and say, now you know about the Tier 3 mitigations. Why do we need this? Because we've continued to increase despite going through Tier 1. I call that, we got the yellow caution light. We just blew through the red stoplight, folks. We're in a traffic accident, right, happening. So we have no indoor dining of any sort, right? It's no, social events, no banquet facilities, no private clubs. And there was, as we moved through all of this, indoor gaming is suspended. And if anyone doesn't recognize the consequence of that, we know that it's a big revenue generator to make that decision as well from a health and a financial. All indoor recreation is suspended, including bowling, which I understand in this region is a kind of another sport that we kind of takes up our winter months, gives us some joy. Theaters, arcades, museums, the cultural aspects of our life. The mayor talked about the limited capacity to 25% at health and fitness, personal care services, hotels, and retail. So we've got reduction capacity. The pain is being felt throughout. And really a restriction on social gatherings outside of your personal homes. Remote work for those who can work remote, including manufacturing. And you will see that we have worked at the health department that 80% of our staff are working remotely so we can reduce our capacity within this building. That means we will still be out there doing inspections, we will still be having our clinical services, we will still be serving our women, infant, and children nutrition programs, doing our naloxone trainings, doing our remote, I'm going to say adolescent education programming, because we've got to protect our workforce as well. Retraining of manufacturing work sites. I think that those of you who went on the pie chart see that manufacturing is one of the larger areas where there's been in the last 14 days, right? So we've got to start looking at that. And again, they're going to be charged with having to set up some more contact tracing. So when a case is identified in those environments, so that they can quickly quarantine and isolate like the schools have been doing. kind of leading us up to the schools. So if you noticed in Tier 3, schools were left up to local decision making. Superintendents and their school boards are reviewing the guidelines for an adaptive pause or return to remote learning in consultation with the health department. We are walking together through this path. The schools have done a tremendous job to prevent the transmission and any outbreaks. But you will see that on Friday that we will be reporting our first outbreak in a school. It's at Spring Creek Elementary, RPS 205, and you see the range will be 5 to 10 cases in staff. So putting some context around why we're in the mitigations, why we're making the discussions about hospitalization numbers for our one system, why we're asking people to be very thoughtful. Today we're reporting new cases of 234. Our total case count throughout the pandemic is 15,719. We are reporting 7 new deaths. And once again, our heartfelt sympathy goes out to the families who have suffered this loss. That brings our total deaths up to 192. Our positivity rate is 18.9%, and our regional positivity is 19.5%. And I've had people say, why don't we focus on the recovery number? If that would stop us from taking risky behavior and increasing our infection rate, I'd be all over it. And the good news is people do recover. We're reporting a 97% recovery rate. But for those who are in the hospital and the ICUs and the healthcare providers, I would say that number's not high enough. We are reporting new locations of concern since Friday. Lincolnshire Place, Milestone, Elmwood Heights, Morning Star Village, Rockford Supportive Living, St. Anne Center, the Atrium Memory Care. So once again, our long-term care facilities who work so hard to keep infection rates down are having the infection brought into those facilities again because they cannot fight off the community spread. So once again, we need the cooperation. The mayor put it very succinctly, and we reinforce it. It's our job. We got to reduce the transmission. So wear your face coverings whenever you are outside of your household. Stay home when you're sick. Maintain your social distancing of 6 feet when individuals outside of your household. And this includes your family and friends. They don't have the magic force field shield when they come over to visit with you. In fact, we would prefer they didn't come to visit you. But if they come into your house, they should be wearing a face covering, as should you, because they are outside your household. Limit non-essential travel. As we look around the nation, as we look around our region, if you've had a chance to see all of our governors in the Midwest asking us to mask up and limit our travel, this is a group that's usually highly competitive about come to my state. Right now, we need us to stay put in our homes in our own state. Limit your contacts and be intentional about the activities outside of your school, your work. We've got curbside, we've got DoorDash, we've got Amazon, we've got all kinds of pickup and capabilities. So use those and shop locally. If you test, quarantine until your test results are received. Nothing makes me more frustrated to find out that they're calling people to get them their test result and they're at work or at school. Obviously that message of stay home when you've tested, somehow we did not get out there. So if you test, you must stay home. And that means you're not going out to go shopping, you're not going to work or school, you're not driving your children over places, you are staying home. And avoid super spreader type events. I'm not immune. I get Facebook, I get mailers and inserts about pre-Thanksgiving events. This is not the time. I think it's an important message we need to get out. We are in a very critical period. Region 1, I hate to say it, was ahead of the curve. We were the sign that the state was not in good shape. But we've got to be able to do this if we want to get to the next light at the end of the tunnel, where vaccine could be coming out at the end of December. We're hearing some very positive news on that. But we've got to get there. If we're not all there, we can't get vaccinated. So with that, we're happy to take any questions.